Hello, everyone, and welcome to Radio One's Home for the Holidays Town Hall, sponsored by our friends there at Blue Cross and Blue Shield of North Carolina. I am your moderator for today, Melissa Wade, and today our goal is to make sure that you are provided with as much information and knowledge as possible as you need about this whole pandemic, this whole COVID-19 pandemic, to make sure that you feel safe and happy to come together with family and friends over the holidays, because you know what, we are ready and we're gearing up to just bring everyone into our homes, and we want to know, if that's the best decision. So we have some wonderful guests on our town hall today. Please help me welcome Dr. Larry Wu of Blue Cross and Blue Shield of North Carolina. He is a medical director and a family physician there. Dr. Wu, how are you?
I'm doing great. Thank you so much.
Thank you for joining us today. And also from the DHSS, the North Carolina Department of Health and Human Services. He is the Chief Health Equity Officer there, Mr. Victor Armstrong. Victor, welcome, and thank you again for joining us so very much with your expertise.
Thank you. And I know that was a mouthful, both what I do and where I'm from.
Yes. Thank you both so very much for being on with us for our Home for the Holidays Town Hall. So look, we are excited. Everyone's excited about the holidays, and they're ready to go home. But with everything that's going on in the midst of this pandemic, these different variants coming out, we want to make sure that they have as much information as needed to know that they are safe and that they're doing the safest things so that everyone stays healthy, before the holidays and after. So we're just going to sit back and have a wonderful conversation and ask y'all as many questions as possible because you know the answers. So, Victor, we're going to start with you. We're going to start with the numbers. Sure. Can you tell us the numbers? How do the numbers of COVID cases in the African American community compare to the number of COVID cases throughout the entire state? Are they pretty much equal, or tell us more about the knowledge?
Yeah. Over 276,000 African Americans in North Carolina have contracted COVID-19. That's about 21% of the total cases throughout North Carolina. And that compares to about 790,000 white North Carolinians, which is about 61% of the total cases. And to put that into context, 21% of the total cases are African American, and African Americans make up about 23% of the total population of North Carolina. And about 72% are white. But most importantly, I think, regardless of race, health experts are warning of a significant impact from the Omicron variant in North Carolina. And so we're preparing for another potentially devastating surge. And for that reason, we are urging people to just get vaccinated or boosted with Pfizer and Moderna as soon as possible.
Yes. Dr. Wu, you being a family physician, I know that you are probably administering so many vaccinations and boosters and everything else day after day after day. Vaccination rates in the African American community have increased. What would you say attribute to this increase?
Well, I think there was a lot of good teamwork throughout all sectors of North Carolina. We had the public health sector, and the most important contribution was to the community sector. We had the messages encouraging vaccine from people who looked like the communities they serve. And they weren't always the physicians, although physicians played a big role. But I think there were a lot of community organizers, religious leaders, hopefully some barbers too, as well as trusted non-health provider leaders of the communities that I think did a great job. I think the other things that we did is we tried to support free transportation. We tried to support some vaccines at home. We really tried to get it into the community. So I think that this groundswell and grassroots push for the vaccine, I think, really paid off, as well as decreasing any financial barriers. We eliminated all financial barriers. And I think to get this pandemic under control, especially among the African American communities, any marginalized communities, we're going to have to continue to pour in the energy of this continued public health push and relying and partnering with the communities who are our partners in this endeavor.
Yeah. Well,
Absolutely.
listen, and if I could add, I saw some numbers earlier this week where about 18%
Hmm.
of total people fully vaccinated identify as Black or African American here in North Carolina. I think prior to, I know at least from the department's DHHS standpoint, we launched a equity strategy back around February of 2021. At that time, people fully vaccinated who identified as Black or African American range somewhere between 3 and 10%.
That's right.
And so I think this, this concerted effort, um, just across the board, as Dr. Wu talked about, I think it is has really raised those numbers considerably. So I do think the strategies are working.
Yeah, I agree with both of you. We have vigorously things like what we're doing right now. You guys coming on with us and letting everybody know, what's there, what's available, how to do it, and things like that. So yeah, things like this are very, very important. So of course, I think I can safely say that everyone is excited and looking forward to coming together. With the vaccinations being out there, more families can come together for the holiday season. Dr. Wu, is this something that you would recommend, considering still the condition of where we are as far as the pandemic in the state?
Well, unfortunately, the virus is not going away. But what we have done is we have learned how to do it safely, how to get together safely, how to go into public places safely. So, yeah, I think there are a list of good recommendations that we can issue if you decide you're going to get together. I think everybody has to make their own personal decisions of getting together with family. And we know that the way to get this virus is seeing other human beings. But on the other hand, life can go on, and I think you can do it safely.
Absolutely. So, Victor, what would you say? Dr. Wu says, yes, we can do it safely. What does this look like? Hey, how do we do it safely?
I think it's possible to reduce risk. And with the holidays approaching and people gathering, it's important that you take the right steps to protect yourself and your family and your friends.
Mm-hmm.
So I think in terms of doing it safely, if you gather, you should get vaccinated, including your COVID-19 booster as soon as you're eligible. And then you should layer protection with also getting the flu shot. And for safer holiday celebrations, consider hosting your gatherings outdoors if possible. If you're gathering indoors, use a space that's large enough to allow for physical distancing. And then I'd suggest considering limiting the number of attendees if you can. And then you can also increase circulation of outdoor air by opening windows and doors.
Sounds good. So with everything that's going on, holidays, we like to get together and do special things. We like to do karaoke. Are there any special, gatherings or activities that maybe we should avoid? I know if we do karaoke, maybe you want to wipe off the microphone or something like that. Any suggestions for you about things that maybe we shouldn't do when we gather?
You'll definitely avoid crowded and poorly ventilated spaces. If at all possible, avoid those spaces. But I think most importantly, if you are sick or if you have symptoms, don't host or attend a gathering, and definitely get tested.
Yeah, and if you can get your hands a hold of some over-the-counter tests, which are available, they do tend to sell out rather quickly. But if you go to your local pharmacies, they have them on display, and if they're available, they can be helpful. So everything that Mr. Armstrong says, first of all, if you're sick, don't participate. Isolate yourself. Secondly, make sure you get vaccinated and you're boosted, because it does show that if you get the booster, you can decrease the amount of the risk of infection. And if you do get infected, you get milder illness. And if you have the milder illness, you're less likely to spread it. It's not a guarantee, but you're less likely to spread it. So get vaccinated also. So I would do all those things as precautions, and in some cases, so if you are able to have everybody vaccinated, and there's people have tested negative just recently, then it may be possible to have karaoke, and keep the windows open. It's good to have fresh air.
Yeah. You kind of led to another question I'm going to ask in a little bit, but let's talk about our children. Of course, holidays, Christmas, it equals children. It equals our kids. And we know that our kids, most of them are eligible for vaccinations, and hopefully most of them have it. But what would you say are the best ways for us to protect our children as we get together, when we come together?
Yeah, first, I would just remind everyone that children are at risk of getting the virus just like everyone else. And the vaccines and getting your kids vaccinated does provide a safe and tested way to keep them healthy. In fact, in the latest surge of COVID-19 in the United States, we saw that pediatric cases rose by about 240%. So it's extremely important. But the vaccines for children are really important to getting them back to safely being with family and friends. And so as we're going into this holiday season, that's extremely important. It's also important to getting kids back to feeling safe in the classroom, being able to play sports, participate in school activities. If you're not vaccinated, don't wait to get vaccinated, and don't wait to get your children vaccinated either. Appointments are available. They're relatively easy to find. If you need help making an appointment for you or your child, you can visit our website at myspot.nc.gov, or you can call the North Carolina Vaccine Help Center at 888-675-4567.
Wonderful. All right, this next question is for both of you. Dr. Wu, we're going to start with you. There are so many different myths that are going on about the pandemic, about COVID-19 and the vaccines especially. If you could dispel one, what would it be and why?
I think the question I get asked the most is safety. And I would say to that getting the vaccine is safer than driving in your car. And we've had a long track record of showing how safe this vaccine is. It's been administered amongst tens, hundreds of millions, billions of people. And we know that the side effects, if they occur, are rare. They're so rare, they're even more rare than getting hurt in a car accident. So that would be the first myth that I would dispel. Most of the vaccines, especially the vaccines that are recommended, consist of messenger RNA. Messenger RNA is a molecule in our body that we encounter all the time without the vaccine, and our body is very efficient in making sure that messenger RNA does not stay in our body for more than a couple hours. So it's not like being exposed to pollution or cigarette smoke that stays in your body for hours and even days. So it disappears very quickly. So safety is definitely a safe vaccine.
That's great. And I love the way you described it, because it makes us, it gives us that visual of saying, okay, it doesn't stay, it actually travels out of our body. All right, Mr. Armstrong, what is your myth? The number one, if you could pick one.
I'd have to agree with Dr. Wu that I think there's a lot of misinformation out there, but I do think the most important one is around safety. But one topic of interest has been around the notion that vaccines are not safe for pregnant women, or might have a negative impact on fertility. But what we do know is that there's currently no evidence that the COVID-19 vaccines cause fertility problems in women or men. Pregnant women with COVID-19 do have a higher risk of being hospitalized and needing care in the ICU, as well as have a higher risk of problems for the baby if they contract the virus. Recent reports have shown that breastfeeding women who have received the COVID-19 mRNA, as Dr. Wu described, they have antibodies in their breast milk that could help protect their babies. Those who are pregnant, recently pregnant, trying to get pregnant, or might become pregnant in the future, you should get vaccinated as soon as you can in order to prevent serious illness or death or any adverse pregnancy outcome. And again, these vaccines are free. They're available to everyone 5 and older, and no government ID or insurance is required to get the vaccine. So I think that's one that I want to dispel, that pregnant women are at risk. And again, I think if you are at far more risk of harm by not getting the vaccine, if you're pregnant or planning to become pregnant, than you are if you get the vaccine.
That was a wonderful point, because pregnant women, those of us who've been there, the last thing we want to do is take anything or administer anything in our bodies that will, harm our child that's to come yet. And so, we're always wondering what medicines can we take or not take. And so that was a very, very good point. Thank you for covering that. A question that a lot of people have that have been fully vaccinated, even myself that have both shots, is the booster. They'll say, hey, look, I'm vaccinated. What do I need the booster for? It's just an extra little bit. I'm already covered. Dr. Wu, what would you say as far as how important is it for those who are fully vaccinated to get a booster?
Yeah, I think it's very important. One thing we know about this family of viruses, the coronaviruses, even before the pandemic, the immunity to the virus gradually wanes over time, over the course of 6 months. And so you do need a booster to reawaken your immune system to fight off this virus. And based on the safety of the vaccine, why not? So we have early information from other countries that have gone through this pandemic and started vaccinating earlier, and we know that the vaccine drops over time. Now, you need to remember that with the flu vaccine, which has been around for almost half a century, you have to get boosters each year. You have to get boosters with tetanus, and vaccination against corona is no different. And as we go through the pandemic, as we learn more, we will find out how often we will continue to need to get boosters.
Sounds good. Mr. Armstrong, would you like to add anything to that importance of getting that booster?
Yeah, it's extremely important for people to get that booster shot. And remember, you get it 6 months after your second dose if you got the Pfizer or Moderna brand, 2 months after your J&J vaccine. And adults 18 or older can get any brand of the booster. Teens 16 years or older, or teens 16, 17 years old can only receive the Pfizer booster, and parental consent is required. But that booster shot extends the effectiveness of that initial vaccine series, so it is extremely important.
Okay, well, so we're gathering for the holidays. We're vaccinated, got a booster. With all of that done, how much would you recommend? And I believe, Dr. Wu, you hit on it a little earlier. Getting tested, getting a COVID-19 test before you gather for the holidays, as well, just to make sure that, hey, everyone's negative. Is that something that you would suggest doing?
Yeah, I would say as an extra precaution, that's something that you can avail yourself of. Now, if you are a person that's fairly low risk, so if you've had no exposures and you've pretty much been working from home, or you've been isolated and you've been vaccinated and you have no symptoms, maybe testing is not necessary before a family gathering. But let's say you're a person who's on the road, or you've been recently in a restaurant for a prolonged period of time, and you're about to gather, and you know that grandma's going to be there and she's got some chronic health conditions like maybe diabetes. I think it would be good if you can get your hands on some testing or some drive-through testing, which, by the way, should be free. It's an extra reassurance to have before you visit people, especially people who are maybe at risk.
Okay.
Yeah, I think, for me, there's 3 basic things that I recommend that people remember to do. One is vaccinate, of course, before gathering, attending events, or traveling. Get the vaccine. If you've been vaccinated, get your booster as soon as you're eligible. And then again, don't forget to layer your protection with the flu shot. Number 2 is test. Get a COVID-19 test before you join indoor gatherings with others who are not people that you live with. And before and after traveling, regardless of your vaccine status, I advise people to get to take a test. They're free. You can get a free at-home test. You can go to www.pixel.labcorp.com / North Carolina or NC. They're free there. And then, the third thing is to mask. Wear a mask indoors, in public, even if you are vaccinated.
Now, you made a wonderful transition there. We talked about the fully vaccinated, those with boosters. Let's talk about those who haven't been vaccinated at all. Of course, we're not talking to anybody that's watching right now because we know you all have been vaccinated, right? But Mr. Armstrong, what is the best form of protection for those who still have not gotten vaccinated from this pandemic and they want to
Yeah.
gather for the holidays?
Yeah, and I it is such an important message. I have friends and family members who have still not been vaccinated, and I'm constantly talking to them about how important it is, and I do that, because they're people I care about, and so I say to people, don't wait to vaccinate. Nearly all of the new COVID-19 cases are in people who are not fully vaccinated. So get a tested, safe, and effective vaccine to protect yourself and others from hospitalization and death. The three things that we want to be able to do is we want to prevent deaths, we want to avoid hospitalizations, and we want to keep kids in school. And the best way to do that is by getting vaccinated. Wear a mask that covers your nose and mouth to help protect yourself and others. Stay 6 feet apart from those who you don't live with. Again, especially if you are not vaccinated. Avoid crowds and poorly ventilated indoor spaces. Get tested to prevent spread to others. And then the tried and true, wash your hands often with soap and water. Use hand sanitizer if soap and water aren't available. But first and foremost, get vaccinated. Please get vaccinated.
Dr. Wu, any words of wisdom for the unvaccinated from you?
Yeah, if you have to get together, what you're going to want to do is everybody needs to be masked, especially those who you'll be socializing with. You want to ask them to wear masks because I think the mask works best on other people potentially spreading it to you. So masking is important. And then the physical distancing, I think, is important. Remember, the getting the illness depends on the dose, and the dose depends on the concentration, which is how close you are, plus the amount of time you spend with them. So if the other people are wearing masks, there's less like the number of viruses that potentially can affect you goes way down. And if you're especially in a well ventilated area, it's much safer than being in a non ventilated area.
Those masks work.
Yeah, absolutely.
They work. As we wrap up right now, Dr. Wu, any last minute information or things that you would like to share with us, maybe some resources or telephone numbers that you would like to share as we kind of wrap up this town hall today?
Yeah, so I think that a lot of the new habits that we've cultivated, the masking, the physical distancing, are going to be helpful habits in the near future. And for recommendations, go to ncdhhs.gov, which is my go-to. It also will give me a list of where all the infections are happening and how bad the infections are. And then the other one is cdc.gov for the latest recommendations. I tend to stay away from news because the news really depends on who happens to be broadcasting, and and some news may not give you the full picture. So I like to go to the website, except for Radio One. Radio One is the best.
Always giving you the facts. That's it. Always giving you the facts.
So first, I would say to anybody who's listening, I'm not here peddling something I don't believe in. I have been vaccinated, fully vaccinated with the Pfizer vaccine. I've had my booster shot. I've had my flu shot. I've got 2 boys at home, age 7 and 9. Both of them have had both their shots. So I've had my kids vaccinated. And so when I encourage people to get vaccinated, I'm telling you something that I practice myself. The other thing I would say is that one of and I think Dr. Wu touched on this earlier about how important it is to have trusted voices in the community to help us in this effort. And I did just want to plug a couple of programs that are doing just outstanding work. I'm actually going this afternoon to Robeson County to visit a kids vaccination site at the Lumbee Tribe Boys and Girls Club that they have there locally. I visited one at Elizabeth City State University in Eastern North Carolina a couple of weeks ago. And just the work that the communities themselves are doing to help get people vaccinated is outstanding. And again, if you're not vaccinated, don't wait to do it. And don't wait to vaccinate your children. If you need to find out where vaccination spots are located, you can go to myspot.nc.gov, or you can call 1-888-675-4567 for more information about safe and effective COVID-19 vaccines. And again, with the with the Omicron variant out there, it is extremely important that we get everyone vaccinated. That is your safest way to prevent yourself and people that you love from getting sick from COVID-19.
Wonderful, wonderful. It's home for the holidays, everyone. Our two guests have really given us some great information that you can share. You can watch this over and over. If there's someone there as you're gathering together and they have questions, you can say, hey, look, wait a minute. Let me go back to this town hall because I remember Mr. Armstrong or Dr. Wu answering this question for Melissa, and here is the fact. So hopefully we have given you exactly what you need to feel safe in your home, gathering with family and friends over the holidays. Again, thank you to our guest from Blue Cross and Blue Shield of North Carolina, Medical Director and Family Physician, Dr. Larry Wu. Thank you so very much for all of your information and your knowledge. And of course, from the North Carolina Department of Health and Human Services, Chief Health Equity Officer, whole bunch of words there, but he has had a whole bunch of information as well, Mr. Victor Armstrong. Thank you guys both for joining us.
Thank you.
That wraps up our town hall today. Home for the holidays. You go, you be safe with the knowledge and the wisdom that you've been given today. Thank you again for joining us right here. Radio One, I'm Melissa Wade. God bless you. Grace and peace.